Health information is everywhere. It's confusing. We're sitting down with doctors to help make sense of it.
Take me to Kraus.
Take me to Kraus.
Take me to Kraus. They saved my life.
Welcome to the podcast studio at Kraus Hospital, and today we are talking about babies. So many women choose to deliver here at Kraus because of the neonatal intensive care unit, where they take care of the sickest, tiniest babies. And our guest today is a board-certified neonatologist. She's also board-certified in pediatrics, so that is a double board certification. She is Dr. Swathi Murthy, and she is here now. Thanks so much for being with us.
Thanks for having me.
When I was up in the NICU with you a few weeks ago, and we're going to call it the NICU for the rest of this conversation, there was a baby so tiny. And I asked you how much that baby weighed at birth, and you said just over 1 pound. And that was so shocking to me. How is it possible that a baby that small can survive?
It really is incredible. Mm-hmm. But that's what we do in the NICU. We take care of babies who are born as early as 23 weeks. And your due date is usually 40 weeks. Mm-hmm. And those babies can be born as little as a little bit more than a pound. And they are immature in all the ways you can imagine. They have skin immaturity. They have difficulty maintaining their temperature. They need assistance with breathing, assistance with nutrition, all of the things. But that's what we do.
Wow. So these babies are like as small as your hand, right?
Yeah.
What's the key to getting a baby who is so fragile to be able to, at some point, go home?
So one of the most important things for that category of what we call extreme prematurity is delivery at the center that takes care of those babies. We know that that's so important for positive outcome. We can certainly bring babies who are born elsewhere here, but we know the best outcomes have when you deliver at the center. Right. And the NICU team is here 24 hours a day, 7 days a week. We always have a physician in-house. We have a multidisciplinary team, nurse practitioners, PAs, respiratory therapists, skilled nurses. And our goal is to be there at delivery when baby is there.
Wow.
And one of the first things we assess is breathing. That's really the limitation for prematurity. And if you're born at a pound, my 23, 24, 25 weekers, most of the time those kids need breathing tubes. So our team is there to assess breathing and place the breathing tube if it's needed, and support that and temperature.
Now, you've been doing this for 10 years.
Yeah.
At Kraus the whole time?
I have been at Kraus since I finished training, so it'll be a decade in August.
So what about the changes that you've seen in that time? Were you saving 1-pounders then?
We were. You know, we've been, taking care of babies that small for a while now. But we've really changed our approach to what we call ventilation and breathing. So we have better ventilators for babies who need breathing tubes. We also have better masks that fit over babies' noses to help support them without a breathing tube if possible, and that's protecting of the lungs. And this isn't so much for preemies, but one of the other things that we're seeing right now in the NICU that's really come a long way in the past decade is the genetic testing available. We can really test for a much wider array of disorders that are related to differences in genes than we were able to a decade ago. And the results come back much faster.
So when people ask the question, why? Why did this happen? That is a clue, right, to why they may have been born early. Is that right?
So we don't know why preterm delivery happens. That would be like the ultimate question that we could solve, right? But us here in Syracuse, our OBGYN colleagues all over the world, we don't know why mothers deliver preterm. There are certain risk factors, but it can't always be prevented. And that's why we have the NICU.
What about the babies who are not premature? You had some big babies in there. I mean, full term, but they have health issues that need this kind of intensive care. A lot of it has to do with the heart, doesn't it?
Yeah. We take care of babies who have congenital heart defects. So those moms will deliver here at Crouse. We don't do cardiac surgery here at Crouse, but we stabilize babies until they're ready for cardiac surgery.
Right.
And we network with Golisano Children's Hospital in Rochester, where they do that surgery. So we take care of babies like that. We take care of babies who were stressed at the time of birth. Some of those babies are cooled for 3 days to help protect the brain. Some babies can be born with infection. We take care of babies like that who are full term.
Right.
And we can, the two other major things I can think of is sometimes babies will inhale their stool or their meconium and can have difficulty breathing.
Right.
That's something that commonly happens to full term babies. And other times there are babies who have other medical issues that make them be different than a typical baby might be. So having difficulty feeding or difficulty breathing, that can happen even if you deliver full term.
So, in rough numbers, I wonder how many moms are completely shocked that they have a baby in the NICU. Like they thought everything was fine. They had a normal pregnancy. The ultrasounds were coming out okay. Everything with the measurements looked okay, and then all of a sudden. How common is that?
Gosh, that's got to be at least 3/4 of our families.
Really?
Yeah. There are some families who had one baby early and now they're expecting another one, or families who they knew there was something different going on in imaging. But a lot of families aren't expecting that preterm delivery. They're not expecting the difficulty breathing. So for a lot of families, the NICU stays unexpected.
Does it kind of run in families? If you did have a preemie, might you be more likely to have another one?
So not necessarily families, but if you deliver one baby preemie, you're certainly at risk for doing it again a second time. And some mothers we have deliver early to protect the mother. So sometimes moms have something called preeclampsia, high blood pressure in pregnancy. So certainly if you have that in one pregnancy, you are likely to have it again. And that could be a reason to deliver preterm.
Now, you mentioned earlier about babies born at other hospitals who can be brought and are brought to Crouse. Where you're talking about, what, like 17 hospitals in the region?
Yeah, 17 hospitals, 14 counties in our region.
Wow.
So we cover at Crouse all the high-risk babies that are born about halfway to Rochester, halfway to Albany, all the way to the Canadian border, down to the southern tier. And we have a transport team who's available 24 hours a day.
And they go to the hospital and bring the baby here,
Absolutely,
right?
yeah.
Wow.
Our team leaves here from Crouse and goes to that baby, helps to stabilize the baby at the outside center, and then brings it back to us.
One of the other things that I think is so fascinating is giving preemies donor breast milk. I mean, this is something that has made a huge difference in the outcomes for you. Can you tell us how it was discovered that that could be from another mom of a preemie, right?
Yeah. So the idea of human milk for preemies being beneficial has been around for a while, at least since the 80s or 90s. And we've known that the feedings from mom's own milk leads to better tolerating, better digestion, and we know that it also helps to prevent a belly infection called necrotizing enterocolitis. So we've known that for a while, and that kind of led to the idea of donor breast milk. But we also know that a lot of the moms that typically donate breast milk are moms who deliver term or moms who are kind of at the end of their breastfeeding journey. And that term milk, or what we call the later milk, is has less protein content. So that made the idea of using breast milk more challenging in preemies. But one thing that we have here at Crouse available to our babies who deliver preterm is preterm donor milk. So donor milk from mothers who deliver preterm.
And it's like a superfood for babies, right?
Yeah, it is. And we're probably one of the few hospitals in the country that has that available.
So now you have a baby who might have been, 1 or 2 pounds, or might have had a congenital heart defect, and then the day comes and they're ready to go home. And then we think, okay, your job is done. But now you follow up with these babies. So you see them again in a follow-up clinic.
Yeah.
At what ages do they come back?
So I do this with another physician whose name's Dr. Bodie, and we do the NICU follow-up together. And we see all of our babies, we say at 6 months adjusted. So if you were born at term, we see you at 6 months of age. If you're preterm, we see you at 6 months from your due date.
Okay.
And then we see our highest risk babies a second time, again, either at 2 years if you're term or 2 years from your due date. And then there's a select few infants that we're pulling out now because we really want to see how kids are doing before kindergarten, and we're bringing them back at age 4 to 5.
So this must give you a great window into what you can maybe tell parents what they can expect, because when you have this tiny baby, you're already, as a parent, you're so worried about the now, but you're worried about, will they be able to, go to school and do what other children do and hit milestones, and will they have issues, and what would they be? This follow-up must give you so much information.
It does. And I really believe that all centers should be partaking in some degree of follow-up. And we are lucky at Crouse. We have a really robust follow-up clinic. And we not only can give our parents information from national and international data, but here in Syracuse, we can also tell you how our babies are doing. And we can also give a little bit of personal story, which is important because every family only has one baby. So if I say, well, statistically, 75% chance of this, that's not always meaningful. But to say there are babies who are in your position who can do well, there is hope. It's so much more meaningful.
Okay, we're going to take a 20-second break, and when we come back, Dr. Murthy talks about how becoming a mom changed the way she practices medicine.
For more information on what you're hearing on this podcast, go to crouse.org/carry. The information in this podcast is not intended as medical advice. It's always best to check with your doctor.
So you have 3 children of your own, 3 girls.
I do, yeah.
Tell me, how did becoming a mom influence how you take care, not only of the babies, because you're taking care of the parents of these babies as well? How did that change when you became a mother?
Oh, gosh. I mean, I think every pediatrician will tell you this. When you become a parent yourself, the journey changes. It's very easy. Safe sleep is a great example. For me to say, put your baby down, slightly awake, on their back, and they will go to sleep on their own. But until you do that yourself, you don't know the challenges.
Right.
And that doesn't mean that changed my recommendation, but I think it changes the way that I deliver it. It makes me more sympathetic to the challenges. The same can be true for when I ask my moms who deliver preterm or moms of NICU babies to express breast milk. Now that I've gone through it myself, I know that it's painful. It's difficult to wake up at 3 in the morning and pump. And unfortunately, that's when your body's milk production is best. Some of that stuff, it just, doing it yourself just makes you understand how hard it is.
And also being able to deal with the worst that can happen. I mean, I can't imagine, you go home to your own healthy children and maybe you've lost a baby in the NICU. I mean, what does that take, Dr. Murthy, to be able to, sort of keep going and come back again the next day and do it all over?
Oh, gosh. It's hard. But I think, one thing that all of us do who work in the NICU in any of the roles is we have to practice leaving work at work. And then it does make you extra thankful for all of the good things that are happening in life outside of work. So,
Would you mind if we ended with a personal question?
sure.
What scares you?
Oh. I guess what scares me about the job. I think the biggest fear that I have is making a mistake or missing something that could impact a baby's life. But I think we all have that fear as people who work in the NICU, and that's what drives us to excellence. Because even when we go home, we're still thinking about our patients. In the case that we lost a patient or had a patient with negative outcome, we use that to learn from it. One of my senior colleagues, Dr. Bufano, says this all the time. We should learn from every single case, especially the ones where the outcome isn't what we wished it would be.
Now, Dr. Bufano has been practicing in the NICU for over 50 years. Do you see yourself 40 years from now still in there?
Oh, gosh.
Imagine what we'll be able to do for the babies
I
then.
can only hope so.
Yes.
When you hear, during Dr. Bufano's career, the edge of viability has progressed so much. They probably weren't imagining 23 weekers, when she started. So I can only hope that I have her stamina.
Well, you're off to a great start. Thank you so much for being here, and I hope you'll come back and share some new information and some insights.
Yeah.
Because, when you're having a baby, take me to Crouse, right?
Yeah, absolutely.
Hopefully, take me to Crouse to have the baby.
Yes.
So that if you need the NICU, it's right upstairs. Right?
Absolutely, yes. And that's what we want all of our families to. We want to be here if they need us, but we hope they don't.
Thank you, Dr. Murthy. And thank you for being here and taking the time to learn about your health. We know that informed patients make stronger decisions, and that starts with information you can trust from people who are actually providing health care in our community. That's why we do this. I'm Carrie Lazarus. Thanks for being here on Take Me to Crouse. And if you'd like to help the Crouse NICU, there's a wonderful event coming up Sunday, July 26th called Polo for Preemies. It's at the Skaneateles Polo Club. They'll have activities for families, food, a silent auction, and of course, a polo match. Proceeds benefit the Crouse NICU. For more information, go to crouse.org/polo2026.